the next important thing we shall discuss are directly the muscles of the sole region. Okay, compare the muscles of the sole region with the muscles of the hand. Most of them are similar, right? The names are different definitely, but most of them are similar. You can relate with them. Okay, so let us discuss about the muscles of sole of foot. Muscles of sole of foot. So obviously here in the hand region we have got intrinsic muscles of the hand. In the same way in the sole of the foot also we have got intrinsic muscles. So how many intrinsic muscles you have got? You have got 18 intrinsic muscles. 18 intrinsic muscles, right? So are there any extrinsic tendons? Yes, there are 4 extrinsic tendons. There are 4 extrinsic tendons. Okay, all these 18 intrinsic muscles where are they located? In the sole of the foot in different layers. For example, in layer 1 there are 3 muscles that are located. For example, in layer 2, right, there are 4 muscles that are located. So in this way each layer some group of muscles are located. Okay, so in how many layers all these 18 muscles and 4 tendons are located? Completely in 4 layers. So we are discussing the muscles of the sole of the foot in 4 layers. Layer 1, layer 2, layer 3 and layer 4. And again I am telling you, origins and insertions are not at all needed. You just need to know the names of the muscle, but still I am going to teach you origins and insertions over here, right? If you just need to know from where till where the muscle is going, so that is more than enough. Okay, so how do you remember all these 18 muscles, right? So very easy thing. First of all, write it down as first layer. I hope you watched my intrinsic muscles of the hand and only then you are looking at this video, so that it would be a little bit easy for you. So first layer, and we come across the second layer. Okay, and after that we come across the third layer, and we come across the fourth layer. Okay, so these are the 4 layers over here. So first layer, second layer, third and fourth. Now in this very important thing you need to know. What is the very important thing you need to know is that the first thing is, whenever you go to a gym, right, let us say you go to a gym and you start flexing 2 muscles, right? Either you flex abductors or you flex adductors. Abductors are called abs, adductors are called ads. Okay, abductors are called abs, adductors are called ads. Okay, so what you do, the first thing you do when you go to the gym is you flex your abs. Okay, for how many days? What is the second thing you do? For how many days you flex your abs? You flex your abs for 42 days. So once the abs workout is done, now you start flexing what? Ads. Okay, now you start flexing ads. So you flex, ads, flex. Okay, flex, ads, flex. Right. What is the fourth layer? All of you know what is the fourth layer. I'll let you know what is the fourth layer. Okay, first of all, let me write down these muscles over here. So here in the first layer, flex your abs. When I tell flex your abs, the first thing you should come into your mind is flexor. Okay, flexor. Okay, let me teach you like this. Okay, so when I tell flex, the first muscle that comes to your mind is, if see, remember one thing, that in the foot, right, in the foot, all the muscles which are located here are flexor muscles, right? They are called as flexor muscles, responsible for plantar flexion. Plantar flexion matlab this is the foot, right? So if I am lifting my foot like this is called dorsiflexion. If I am depressing my foot like this is called plantar flexion. Okay, so all the muscles which are located here, I mean in the foot region, right, they are plantar flexors. Now all the muscles will be flexors. So there is a flexor muscle that is attaching to the digits. Flexor muscle attaching to the digits is called flexor digitorum, and the tendons are small, then what do you call it as? Flexor digitorum brevis. Okay, so the first muscle over here is flexor digitorum brevis. Flexor digitorum brevis, right? Second important muscle is that, for example, let us say this is my toe. right? Compare this, just think that this is my toe. Now, if I'm attaching a muscle over here, look carefully. If I'm attaching a muscle over here, right? Now, when I'm contracting this muscle, you see I'm pulling this muscle, and how is my finger moving? You see, again I'm pulling this down, my finger is moving laterally like this. My finger is moving laterally. If my finger is moving away from my body or lateral to my body, you call this as abduction, right? Abduction. Now, this muscle which is attached here is called as an abductor muscle. But this abductor muscle is attached to your thumb or toe. It is attached to toe. So, toe in Latin you call it as hallux, whereas thumb in Latin you call it as pollex. So, what is the muscle which is located in the toe? Abductor hallucis. Okay. So, the second muscle is abductor hallucis. Next important thing is third one, right? See, there is a muscle that is attached here. This is abductor hallucis, right? So, when I am pulling it, my finger is moving laterally. In the same muscle, similar way, there is a muscle that is attached to the little finger also. Little finger of not hand, little finger of the toe. Always compare with the toe only, okay? I am just showing it to you here. Little finger of the toe. Now, when I am contracting, pulling this muscle down, look what is happening. When I am pulling this muscle down, my little finger is abducting, and little finger in Latin you call it as digiti minimi. So if there is abduction like this muscle you call it as abductor digiti minimi. Okay, so abductor digiti minimi, right? So how many muscles do we have? Flex. What do you mean by flex? Flex is flexor digitorum brevis. Abs. So here it is abs, here it is abs. So what is abs? Abductor hallucis, abductor digiti minimi. I don't think so it is difficult for you to remember. So in the first layers, how many muscles do we have? We have got 3 muscles over here. Okay. Now coming to the second layer. So if you can see here very clearly, in the second layer here, we discussed that there are 42 days. What do you mean by 42 days? 42 days in the sense, for example, 4 lumbricals. We have got 4 lumbricals, and in the same way we have got 2 tendons. 4 lumbricals and we have got 2 tendons over here, right? So 42 stands for 4 lumbricals, and here we have got 2 tendons. And what does D here stand for? Days. What does days means? See, days in the sense, for example, you have got a muscle, you know, in the hand region that is called as flexor digitorum superficialis, right? There are 2 muscles, flexor digitorum profundus and flexor digitorum superficialis. So what did I tell you? This is a distal phalanx, middle phalanx and proximal phalanx, okay? Flexor digitorum superficialis attaches to the middle phalanx. Flexor digitorum profundus attaches to the distal phalanx. So this muscle D stands for flexor digitorum accessorius, okay? Flexor digitorum accessorius. So this flexor digitorum accessorius is similar to flexor digitorum superficialis, and where is it attaching? It is attaching to the middle phalanx of your lower toe, right, or of your foot. So D stands for digitorum. What digitorum? Flexor digitorum accessorius, okay? That is flexor digitorum accessorius. Right. So this is the next group of muscles. Now after that, the third layer is again having flex adds flex. Now what is this flex adds flex here? So let us see what is this, okay? So flex adds flex. First important thing. Now all of you, we have seen, see this is that toe, for example, okay? So there is a muscle that is attached exactly in the center. Now when I'm pulling this, my thumb is flexing. If this is a toe, my toe also will flex, right? So this should be a flexor muscle or extensor muscle? Flexor muscle. Attached to what? Attached to toe, right? Toe you call it as hallux. So flexor hallucis, and this muscle tendons are short, brevis. Flexor hallucis brevis. So flex here stands for flexor, hallucis, brevis. Okay, right. After that, next important thing is that, see, we have already discussed that there is a muscle here. When I'm pulling this muscle, there is abduction, right? So what was the muscle we called as abductor hallucis? Exactly opposite of abduction is what? Adduction, right? So if I'm pulling like this is abduction, right? So again this finger is going back to my body. It is because of adduction, adductor muscle, right? So this muscle you call it as adductor hallucis. When there is abductor hallucis, there should also be adductor hallucis. Adductor hallucis. Okay. The next muscle is flex again. So here it will be flexor digitorum. The next muscle will be flexor digiti minimi brevis. Digiti minimi brevis. Okay. So these are the next three layers of muscle that are located here in the foot. Right. So these are the next three layers of muscle that are located in the foot. Right. Now after this we will go across the last layer, that is a fourth layer. So even in the hand also, first we discuss thenar muscles, then we discuss hypothenar muscles, then we discuss lumbricals. After the lumbricals, the last two layers will be what? The last two will be palmar interosseous, dorsal interosseous. So here also you have got palmar interosseous and dorsal interosseous. Palmar interossei and dorsal interosseous. Okay. Now all these are the muscles, guys. So once again, how many layers do we have? We have got 4 layers. How many muscles do we have? We have got 18 muscles and 4 extrinsic tendons. Okay. So first thing is flex abs for 42 days. Again flex adds flex. Okay. So flex abs, when it will flex abs, so you should remember this particular mnemonic over here. Flex in the sense flexor, abs in the sense abductor, abductor. Okay. Second important thing, 42 days. 4 in the sense 4 lumbricals, 2 means 2 tendons. D. Here D here, right? D here stands for digitorum. Okay. Next flex adds flex. So flex adds is adductors, again flex. Okay. And finally we have got PI, DI, that is palmar interosseous as well as dorsal interosseous. So the function of palmar and dorsal interosseous, whatever it is there in the upper limb, the same will apply to the lower limb also. Okay. So when I tell palmar interosseous, what is the function you should know? And when I tell dorsal interosseous, what is the function you should know? So simply remember, palmar P stands for P. So PAD, pad. When I tell dorsal interosseous, D. So DAB, dab. Okay. So for example, these are my fingers, right? So when I'm closing my fingers, all my fingers are coming towards each other. So this is called adduction. And this adduction is done by palmar interosseous. When I'm opening my fingers, right? So all my fingers are moving away from each other. This is called abduction, right? And this is done by dorsal interosseous. So palmar interosseous is responsible for AD, standing for adduction, and AB standing for abduction. Right. Now let us see what is the nerves that are, what are the motor nerves that are innervating this. Very easy way to remember is that there are two nerves. Okay. Either there is medial plantar nerve or there is lateral plantar nerve. Okay. So first of all, we shall see what are the branches of medial plantar nerve. So there are two nerves that are innervating all these 4 layers. Either there might be medial plantar nerve, or there can be lateral plantar nerve. Okay. Now if you look at this, the mnemonic which you need to know is that high level HD videos, right? So just remember it as high level HD videos. Now when I tell high, H stands for hallucis. What hallucis we have got? We have got flexor hallucis. Flexor hallucis longus. Okay. Next, L here. L matlab kya? Lumbricals. Which lumbrical? The first lumbrical. How many lumbricals we have got? 4 I told you, right? So he is talking about the first lumbrical. And again H. H again stands for hallucis only. So this time it is abductor hallucis. Abductor hallucis. And finally here D. What does D stand for? Digitorum. What digitorum? Flexor digitorum brevis. Right? Flexor digitorum brevis. So all these muscles which you can see here, all of them are innervated by medial plantar nerve. Okay. Now these muscles are here itself, right? So for example, flexor hallucis longus. Where is flexor hallucis longus over here? Right? So this is an extrinsic muscle. It is flexor hallucis brevis. Okay. So flexor hallucis brevis. So let us see where is flexor hallucis brevis. See, here we have got flexor hallucis brevis. You see, we have got flexor hallucis brevis over here, right? And after that, the first lumbrical. So out of 4 lumbricals, the first lumbrical over here. Okay. Next important thing, abductor hallucis. Where is abductor hallucis? See, in the first layer, I think, yeah, abductor hallucis we have got. And next we have got flexor digitorum brevis. So flexor digitorum brevis, where is this? Flexor digitorum brevis is this. So these are the muscles which are innervated by medial plantar nerve. अब ये muscles छोड़ के leaving these muscles, the remaining all are innervated by lateral plantar nerve. So you need not to learn specially what are the muscles that are innervated by lateral plantar nerve. Other than this, remaining will be lateral plantar nerve only. So if you just remember this, then that would be also easy for you, right? So other than this, remaining are innervated by lateral plantar. Remaining are innervated by lateral plantar nerve. Others are innervated by lateral plantar nerve, right? So what do we do is that, see, this information which I have given you is more than enough, but still for your exam purpose this is enough, right? But for your day-to-day classes and vivas and all, for that we need to know how does this muscle look, right? So let me draw these muscles one by one, okay, so that it would be easy for you, right? So the first important thing I wanna tell you here is that, first of all, let us name the bones over here, right? So this bone which you can see, right? So from the plantar region itself, we will see one by one, okay? So here all of you know that this bone which you can see, which I'm drawing right now, is your heel bone, right? And what is this bone name? So this is your calcaneus bone, okay? So after that, you have got couple of bones here. This is another bone, so I'll name it later. Right. So if you look at this, right? So this bone over here is your calcaneus. This is your calcaneus. Okay. Now after calcaneus, and this bone over here is called as your calcaneus. Now after calcaneus, this bone which you can see here, right? So this is your navicular bone. Navicular bone. And next here which you can see, this one over here is called as your cuboidal bone. Cuboidal bone. Just beneath the cuboidal bone, you have got 3 things. So let us say 1, 2, 3. What are these 1, 2, 3? These 3 are called cuneiform. So one which is completely medial is called medial cuneiform. One which is in the center is called as intermediate cuneiform. One which is lateral is called as lateral cuneiform. Okay. So in this, what are the medial, lateral as well as intermediate? So 1, 2, 3. All these are cuneiforms. So the first one is called as medial cuneiform. The second one is called as intermediate cuneiform. and the last one is called as lateral cuneiform. Lateral cuneiform. Lateral cuneiform. Okay. Now just beneath this, we have got, see, these are the carpal bones. These are like carpal bones. Now after that, we have got tarsal bones, right? So here these are the tarsals, and after the tarsals we have got metatarsals, right? So these will be your metatarsals. So let us say this is your first metatarsal, right? This is your second, this is your third, this is your fourth, and this is your fifth. Fifth metatarsal. Now after that you have got phalanges. So in the thumb you have got only two phalanges. So here also only two phalanges will be there. So let us say this is your proximal phalanx like this. These are your proximal phalanges, and next you have got your distal phalanges also. So in the toe you have got distal phalanx, but that will be the middle phalanx for remaining fingers. Clear? So here you have got additional phalanges all the way like this. In this way, right? So here if you see, what are these bones over here? So this bones which I am shading with the yellow, right? So these bones are metatarsal bones. So these bones here are called as metatarsals. So after these metatarsals, the next group of bones which you have are called as phalanges. For example, here these are called as proximal phalange. Proximal phalanx. This one over here is called as middle phalanx. And the final one, this one is called as your distal phalanx. Okay, but in the thumb region you have got only two important things. So one is called as a proximal, another one is called as a distal, right? I mean the toe, the great toe, right, which is similar to the thumb. So this is something very important which you need to know. So first we shall discuss what are the muscles that are located in the first layer. Okay, so let us see what are the muscles that are located in the layer 1, right? So in the layer 1 you have got a muscle that starts all the way from the calcaneum, and look here now, where is this muscle inserting? This muscle all the way inserts, and by the way this is the medial side, this is the lateral side. All of you have to remember, medial side is the place where we have got our great toe. Okay, so this muscle all the way from the calcaneus, it will come all the way down, and it is inserting to which phalanx? Yes, exactly, compare that. Which phalanx? Proximal phalanx. So here it is inserting to the proximal phalanx. Okay, for example, if I am contracting this muscle, what will happen? So this entire part, whatever is there, that will move aside, right? So that entire part will move aside. So that is called as what? Abduction or adduction? Abduction. So abduction of which finger? Pollex or hallux? Hallux. So this muscle is called abductor hallucis, right? In the same way, we have got another muscle that is attached to the same proximal phalange of your little finger. Okay, so what this muscle is called as? This muscle also performs abduction, so abductor, but to the little finger, right? So you call it as digiti minimi, abductor digiti minimi. Okay, so this muscle over here, you see, this is called as abductor hallucis, and this over here is called as abductor digiti minimi. Okay, now after that, the next muscle is in the center. You see, this is the muscle that is coming out, right? Now where is this muscle inserting? See, so where was flexor digitorum superficialis inserting? Distal phalanx or middle phalanx? It was inserting to the middle phalanx. So here also this muscle comes all the way and inserts to the middle phalanx like this. Middle phalanx like this. So this muscle is in comparison with flexor digitorum superficialis, and this muscle here you call it as flexor digitorum brevis. Okay, so this is called as flexor digitorum brevis, which is comparable with flexor digitorum superficialis of your upper limb, right? Now after this we shall discuss The next layer, so these are the muscles that are located in the layer 1. Layer 1, right? Let us see now the muscles which are located in the layer 2, right? So before we see, one very important thing I want to tell you is that you know that we in the upper limb we have got something here. This, there is a tendon that is going all the way and it is attaching to the distal phalanx of your thumb, right? So this tendon over here is called as a flexor. So this is called as flexor and it is attaching to the thumb, so pollicis, right? And the tendon is longus. So this one is called flexor pollicis longus. So similar to flexor pollicis longus, instead of pollicis if you put hallucis, it will become flexor hallucis longus. So there is a tendon, see here, there is a tendon that is starting all the way from here and this tendon attaches to the distal phalanx here. This is called flexor hallucis longus, okay? So this one over here is called as flexor hallucis longus, okay? Right, next important thing is that from here we have got a tendon like this that is coming like this, and where is this attaching? See, this is attaching all the way to the distal phalanx like this, in this way, right? Now what is this tendon over here? So let me draw these tendons wide apart so that I have to draw a muscle also in this way, right? So what is this? This is attaching to the distal phalanx. So if anything is attaching to distal phalanx, you call it as flexor digitorum profundus. That was in the upper limb, right? But now what do you call it as? You call this as flexor digitorum, not profundus, flexor digitorum longus, okay? So this you should call it as flexor digitorum longus, okay? So flexor digitorum longus is similar to flexor digitorum profundus. Now exactly here we have got a muscle, okay? So let me rub this arrow over here to draw the muscle. So this was flexor digitorum profundus, right? Or the longus. Now exactly here we have got a muscle. See, this muscle is having two bellies like this. And where is this muscle attaching? This muscle is attaching all the way to this tendon. Okay, this muscle is attaching all the way to this tendon over here, right? And this muscle is called as flexor digitorum accessorius, okay? So what do you mean by flexor digitorum accessorius? This flexor digitorum accessorius is attached to flexor digitorum longus, right? And what will happen is that, for example, let us say these are the tendons. These are the four tendons of flexor digitorum longus. Sometimes what will happen is that these tendons will cross like this, or these tendons will flex in this way. So when these tendons are moving in an opposite direction, what will happen is that these two muscles, accessorious muscles, so my hand represents accessorious muscles which are attached to tendon. So these accessorious muscles, they'll pull the tendons. When they pull the tendons, again the tendons will become straight. You see, it is like this. Now they're pulling it back, again they are becoming straight. So what is the use of these accessorious? These accessorious muscles, time to time, they straighten your flexor digitorum longus tendons, okay? So what are these muscles over here? Flexor digitorum accessorius, okay? So flexor digitorum accessorius, what do? They straighten the flexor digitorum longus tendon, okay? Flexor digitorum longus tendons. Now apart from this, in the second layer, what did we discuss? Let me go back. Yeah, in the second layer we discussed flexor digitorum accessorius, two tendons, aka flexor pollicis longus, no, flexor hallucis longus, and after that flexor digitorum profundus, no, flexor digitorum longus, okay? Now four lumbricals we told, right? Now what are these four lumbricals and where are these located? See, when we were discussing in the upper limb, the lumbricals, they originate from flexor digitorum profundus. So here also lumbricals will originate from the similar muscle like flexor digitorum profundus. What is that? Flexor digitorum longus. So how are the lumbricals originating? We shall see now. So this is the first lumbrical, and look now. This is your second lumbrical. Okay. So this is your third lumbrical, and this one is your fourth lumbrical. So how many lumbricals do we have? We have got 4 lumbricals. This is your first, this is your second, this is your third, and this is your fourth lumbrical. Okay. But what is the difference between all of this? The first lumbrical is the only lumbrical in the lower limb which is unipinnate. But 2, 3, 4 are bipinnate, right? So the first lumbrical, second lumbrical, third lumbrical, and fourth lumbrical. Okay. So the first lumbrical is unipinnate. Okay. Remaining all lumbricals are bipinnate. So this is one important thing you have to remember over here, right? So this is the muscles which are located in the second layer. These are the muscles which are located in the second layer. Now after this, now we shall go to the muscles in the third layer, but third layer you need not to know the pictures. So till first, second layer is very important, and directly we can go to the fourth layer. Okay. In the fourth layer, we will discuss about palmar as well as dorsal interosseous. So these are very, very, very important. So first of all, let us look at the palmar as well as the dorsal interosseous component. So here we will look at the palmar as well as dorsal interosseous muscles which are located in the fourth layer. So first important thing, we will look at the palmar interosseous, and then we shall look at the dorsal interosseous. Okay. Now palmar interosseous, from where do they arise? They arise from the medial side. For example, this is the first metatarsal, second metatarsal, third metatarsal, fourth metatarsal, and fifth metatarsal. So they arise from the metatarsals. Which side of the metatarsals? Lateral or medial? They arise from the medial side of the metatarsals, which means, see, so medial side of third metatarsal, medial side of fourth metatarsal, medial side of fifth metatarsal. So these 3 muscles which you have drawn are palmar interosseous. So palmar, how many palmar interosseous we have got? 3 palmar interosseous. And can I tell all the palmar interosseous are unipinnate? Yes. Okay. So we have got 3 palmar interosseous. So these palmar interosseous, they are arising from the medial side. Okay, they are arising from the medial side of 3, 4, and 5 metatarsals. 5 metatarsals, and all of them are unipinnate. All of them are unipinnate. Okay. Now let us go with the similar picture where we will see the dorsal interosseous. Okay. So we shall go to the dorsal interosseous. We just discussed palmar interosseous. Now we shall discuss about the dorsal interosseous. So here we shall discuss mainly about a dorsal interosseous. Okay. So here we shall mainly discuss about dorsal interosseous. Now in this dorsal interosseous, let us see where are these muscles located. First of all, let us number the metatarsals: 1, 2, 3, 4 as well as 5. So here we have got our first dorsal interosseous, we have got our second dorsal interosseous, we have got our third dorsal interosseous as well as fourth dorsal interosseous. How many dorsal interosseous we have got? 4, and all of them are bipinnate. So we have got 4 dorsal interosseous, and all these 4 dorsal interosseous are unipinnate or bipinnate? They are bipinnate. They are bipinnate. Okay.